And let's continue with more of the What's Up show today as we're going to get a chance to talk with Monica Everson from Prairie Lakes Healthcare System joining us right now on the program. Good morning, Monica.
Good morning.
Glad you can join us today.
Yes.
Give us your title over there.
I am the Director of Emergency Services at Prairie Lakes.
Oh, very important role you have.
It is.
Now, May is American Stroke Month, so let's talk about stroke. And obvious question, am I more at risk or are you more at risk?
Actually, it is me. Women are more at risk than men. 1 in 5 women will have a stroke.
1 in 5?
1 in 5. And actually, stroke is the number 3 leading cause of death in women.
That's a high figure when you look at that.
It is. It is something we as women, and really as men, all of us need to pay attention to.
Okay, so you and I, we have to hopefully decrease our health risk. What do we need to do?
First of all, we really need to, the number 1 cause of strokes is high blood pressure. So we really need to pay attention to our blood pressure. And what do we do for that? We need to know what our blood pressure is. So we need to check it regularly. And I would ask that you trend it, so you write it down. So if you're checking it at home, write it down. So when you go into the doctor, you can tell them what it is at home, because some people have a tendency to have a higher blood pressure when they're at the doctor. So I want to know what your blood pressure is at home and what it is at the doctor. Other things you can do is don't smoke or vape. Eat healthy foods, so those that are low in saturated fat, those that are lower in sodium or salt. Make sure that you're exercising regularly, keeping a healthy weight. And if you're going to drink alcohol, make sure you limit that. 1 to 2 drinks a day for all of us.
When you talk about looking at your blood pressure, you do have to, most people have to buy that little device, wouldn't they? Or can they go into like a store and use one of those monitors? I don't know how safe or how accurate those are, but what's the best way? Is it just buy something and take it every day?
Yeah, it is. And I think the other thing about it is we educate patients when you actually take your blood pressure, make sure you sit for about 30 minutes before you take it. Don't just come into the house and take it quick. Come in, rest for 30 minutes, and take your blood pressure. So that way you're getting the true value, and then write it down. Don't just say, oh, it's usually this. No, but what is it? Actually take it, write it down, and trend it so that we can see what is your true blood pressure.
Better in the morning or better in the evening or better midday?
I think that maybe doesn't matter as much as taking it at the same time.
Okay. Around the same time every day if you could.
Yep.
Jot it down so when you come in, you've got a record. This is what it normally is.
Yes, correct.
Okay, wonderful. Now, there's a Prairie Lakes Healthcare participation called Lifeline Stroke. So talk about this initiative.
So Mission Lifeline, years ago we rolled out one focused on the heart, and it was like Mission Lifeline STEMI. So now the state is shifting gears, and we're talking about stroke. And it is a statewide focus, and all of us are getting together. So all the health systems, EMS, and even some of the rehabilitation centers, we're all getting together and getting on the same page. So no matter where in South Dakota you're having a stroke, you're going to be treated the same. Granted, we all don't have the same capabilities, but when you walk in, you'll get the same assessment, you'll get some type of imaging, and then get the same type of care. So whether, like at Prairie Lakes, if you came in and you're having stroke symptoms, you would get a CAT scan, so we'd scan your head, and then likely if you're truly having a stroke, we would initiate a flight to a different facility and give you medications. Now, we're standardizing. That way, no matter where you are in the state, you're going to get the same type of care, and there'll never really be a question. Even for different nurses working or different physicians working, we'll always have the same process.
No.
And it's just one of those things, so we don't create errors. I just really appreciate it, even like when it came to Mission Lifeline STEMI, where if our physician is tied up in another room, we as nurses know exactly what to do every single time. So it'll be the same thing with a stroke. A patient walks in, these are their symptoms. We know what to do. There's never a question.
Warning signs of a stroke. You talk about a person walking in, they think they're having a stroke.
Sure.
Kind of explain, am I really having a stroke?
So they came out with a little something to remember. It's called B.E.F.A.S.T. So the B in B.E.F.A.S.T stands for balance difficulty. So are you having difficulty even just standing? The E is eyesight changes, F for facial droop, A for arm weakness, S for speech difficulties, and then we in healthcare want to know what time it started. So that's what we're teaching. That's really what we're going to focus on. So if you experience any of those different issues, that's when you need to really be asking yourself, am I having a stroke? Am I having am I having difficulty standing or walking?
Okay.
Is my eyesight changing? Can I see like I normally can see? When I smile, is one side drooping? Can I see all my teeth when I smile? Arm weakness, is one side weaker than the other? When I talk to you, are my words slurred? And then I want to know what time it started. And why I want to know what time it started is we want to start what we call the clot buster. I think that's what we all remember, or we all think of when we think of a stroke. We need the clot buster. Within 3 hours of a patient having their symptoms, that's when they'll have the best outcome, is within that first 3 hours, if we can initiate that.
Now, for a couple, it's easier because your partner can see the signs. You, like me, if I was just alone and I'm thinking I'm having a stroke, it's tough for me to really see, okay, am I drooping?
Yeah,
and all
true.
this and that. So if I'm alone, basically be more cautious, I guess.
You really should be. And I don't know, and not everyone will have all of those symptoms. They may only have one of those symptoms. They just really need to be cognizant of something is not right. I woke up this morning, or I even sat in my chair, and when I got up, I can't see. Even if it's just one eye, I really can't see peripherally out of my right eye what is going on. Be cognizant of that, and don't wait. Oh, it's just going to go away. It'll just go away. Is it though?
That's a real good question. You think, everything's okay. It's just,
I know,
just a minor thing. I can hold off, but it can be a major factor in your health.
It really can, and a stroke can be very debilitating. You may survive a stroke, and it might not be life-threatening, but it can be very life-altering. You may not be able to do all the things you could do yesterday because of a stroke.
I love the way you beat this down. B.E.F.A.S.T.
Fast.
Yeah, so if they keep that in their head,
Yep.
okay, what's my warning signs? And I have maybe this one and this one. I should get in as quick as I can.
Yes, sir.
Okay. Best way, just come up to the emergency room and be checked over, I'm guessing.
Yes, and actually we too are partnering with this education with the Watertown Fire Rescue. So if you don't feel like you can get here alone,
Okay.
you can always dial 911 and have them bring you, or present to our emergency department at Prairie Lakes.
Okay. It is American Stroke Month. This is important information we're trying to get out to our listening public. Is there anything else that you wanted to point out to our listeners today, Monica, that they should be aware of?
I would just encourage you to know what the signs and symptoms of stroke are, and I would also encourage you to just, if you are, say, a smoker or have any of the not so healthier risk factors of a stroke, if you are a smoker or don't have a lot of physical activity in your life, I would just encourage you to do that and then seek primary care to ensure that you are healthy.
Okay, so if a person has more high blood pressure, I know they're monitoring that quite a bit right now because that's one of the things they got to keep track of.
Yep.
With again the blood pressure you talked about.
Yep.
Monica, thanks for joining us on the program here today. And any questions, you can always go to their Prairie Lakes Healthcare website and get more information there too.
Yeah.
All right.
Great.
Have a wonderful day, and thanks for being on with us today, Monica.
Thanks, Mike.
All right. Take care.
Oh, boy.
All right, there's Monica Everson. Again, she's the Director of Emergency Services at Prairie Lakes Healthcare System right here in Watertown. So, again, keep those initials in mind, B.E.F.A.S.T, B.E.F.A.S.T. And be aware that, yes, women are at more risk than men for getting a stroke.